Yeah, my name's Nikki Baker from the School of Health Sciences, and Pauline's here today as well to help present the information. Unfortunately, Rebecca couldn't make it today. We're looking at the perspectives of education of international students in the School of Health Sciences. So we'll touch on the background of the literature, and we'll explain the methodology of the study, and we'll present some of the data from the 3 surveys and discuss the implications for the School of Health Sciences. So the school involves nursing, physio. Whoops, what's happened there? Sorry, seems to have disappeared on me. Radiography, occupational therapy and orthoptics, and we have international students mainly from China, Hong Kong, Saudi Arabia, Kuwait and Oman, but there are others as well. Background literature-wise, very little research within physiotherapy, radiography, orthoptics and OT, mainly nursing-related literature.
Nicola,
yeah.
Apologies to disturb you, but we can't see your screen now.
Oh,
You've stopped sharing your screen.
Sorry, apologies. Don't know why that happened. Can you see it now?
Yeah.
Yes, perfect.
Thank you for letting me know. Yes, so this systematic review by Eden was conducted in Australia, and particularly related to literature from Australia, US and Finland, and identified international students particularly having difficulties with language and culture, isolation and the need for support and resilience. Very little research in the UK related to healthcare students. This one small focus group study from Cardiff actually doing it's not clear which AHP allied health professional students were involved, but the key themes coming through were communication, cultural differences, relationship difficulties and survival strategies. So the aim was to explore the experiences and attitudes of clinicians, supporting students on placement, lecturers and other uni staff, international health students. So there were 3 online surveys, one for the students, one for staff at the university and one for clinicians. They were a mixture of open and closed questions, and between the 3 of us, we are working on the thematic analysis at the minute. So we're still analysing the data. It's not fully complete. So the results from the university staff survey are not fully analysed yet. We had international students, 29 international students across all subjects represented. The university staff survey, we had 44 responses, mainly from lecturing staff, but some support from other members of staff as well, and 89 respondents from all of the different specialities, clinical educators. Over to Pauline.
Thanks, Nikki. Okay, so you can see from the student survey that we've got a real cross-section of different nationalities, particularly China and Hong Kong, Oman and Saudi Arabia. Next slide, please, Nikki. And we also had a mixture of different years of study with mainly first years, but we did get some second and third year students as well. Next slide. Okay, so we did ask the students how they found their placements, and most students found them either as good or very good. Some students hadn't been on placement at that point, so they will have been first year students. And we also asked them how, in their open comments, they actually found placements quite interesting and enjoyable. Surprisingly, they found travelling to the placements expensive, but they had supportive educators, and some students found the placements too long in terms of duration and hours worked. Next slide, please, Nikki. Okay, so we do simulation with our students before they go out on placement, as an opportunity to prepare them. And actually the students did overall find that there was 37% who found it useful. It was interesting that 55.6% thought, I'm not sure, maybe it was helpful. But overall in their open responses, they actually wanted more simulation, and that it was a good opportunity to prepare them for professional practice placements. Next slide, please. We did ask them how simulation might be used to support their learning, and their suggestions were that actually they enjoyed doing practical situations, being put in those situations, and again preparation for placement, and they like that simulation more often. Next slide. We did also ask them, the students, if they'd accessed any support while they were studying, and what you can see here is that the students are actually accessing Kaplan. They're also accessing the International Advice and Guidance team, as well as student support services and the English Language Centre, which is pleasing because obviously those services are there for those students. Next slide, please. We also asked them to say, was there anything else that they might find helpful to support them as an international student? And really, a lot of it was around understanding the expectations of the university and the lecturers, but also expectations on placement, as well as when they're on placement, they'd like more support, as well as support with English language, but also help in understanding cultural difficulties. They also would like more support before they actually start university, and also when they finish university. Next slide, please, Licky. So just to summarise, obviously they've experienced difficulty, our international students, in terms of COVID. They don't actually like the party stroke alcohol consumption of UK students. They've had IT issues, expensive travel costs, and some placements have felt too long. The solutions to that, though, are that we're going to use more simulation. They'd like us to continue with a more inclusive, friendly culture, more opportunities for practical assessments with local students, help with cultural difficulties, and again, understanding those expectations of placement and lecturers, and more support on placement, and both before they start and when they finish university. Okay, lovely. Over to you, Nikki.
Yeah, just looking at the clinician survey, you can see that they supported students throughout the years at uni and a range of countries. How well did the students do on average? They did pretty well. There was 17% that didn't do very well, so it was quite useful to have that perspective as well. Again, common themes coming through, so issues with communication, particularly colloquial phrases, accents, and also written documentation was tricky. Professionalism, particularly timekeeping, safety issues, and really an awareness of cultural differences was coming through as well. From a clinician's point of view, was there anything else that the university could do to prepare them? And they said yes. And so there's some of the suggestions from the clinicians, again, going back to communication and practicing communication and cultural differences, giving them a preparation for working as an allied health professional in the NHS, some specific teaching aspects, and also some pre-placement prep that they felt was needed. We asked them, did the clinicians feel prepared? And on the whole, yes, but over 30% saying not sure. They felt they needed more knowledge of the cultural differences, the pressures on international students, and more guidance and support from the university. We asked them, are they aware of the support the university provides? And quite surprisingly, 85% said no. So we feel that's something we need to be looking at. So just to recap then, difficulties, language barriers and communication, teamwork and interaction between the staff and patient, cultural differences, and then solutions, some really useful ideas, working on communication, particularly simulation, preparation for the NHS, encouraging more mixed events between national and international students, a buddy system, which we're going to be looking at and have been looking at providing. As you can see, lots of other suggestions, but just pulling it all together, you can see that the yellow indicates the overlaps between the staff and the students. The green is just the students' ideas, and the purple is the clinicians' ideas. And then really, what does it mean for the School of Health Sciences?
So for the students, what's coming out loud and clear from the data is the need for more simulation, more communication practice, more interaction with local students. I think a greater understanding of the NHS and more support on placement. For the clinicians, they would like written guidance, more university to support, and they suggested perhaps one international student per placement. And I'm not sure what the incentives were because they didn't specify. And for both students and clinicians, more information about cultural awareness and increased awareness of university support systems.
And that's us. Thank you very much.
Brilliant, brilliantly timed. I'm going to pass over to John, and thank you very much for a great talk. So John, do you want to manage kind of the questions that we've got going?
I actually had a question myself to start off with. If that's okay, a bit selfish, you know. But I love attending these talks. It's really, it's like, oh, I'm going to be one of those people now. Say it's not a question, just an observation, really, to kind of add to some weight to what you're doing. The University of Birmingham did some work with. It's going to sound totally left field to start off with. Did some work with LGBTQIA students, and also found that they wanted more of a culture that did not revolve around drinking and partying as well. So it's really interesting that findings coming clear from different groups of students. So I just wanted to kind of raise your awareness of that, really. But Lisa Brennan has a much more interesting question or observation than that. So Lisa, do you mind me asking it in the chat? Is that okay, Lisa, or would you like
that's fine. That's fine.
Yeah. So what language support do you think students need? Could language work be integrated into some of the simulations?
Yeah, definitely. I certainly, I think, I mean, I was working at the University of Leicester before I came to University of Liverpool, and the accents can be quite tricky over here. I definitely think it's a real sort of colloquial accent, but also with sort of the mixed culture that the students are coming across, that sort of understanding the different English, how would you say, sort of differences between so many different groups of patients that they come across. That's one thing, and I think certainly from a sort of a non-verbal perspective as well, because there is so many different meanings in how we express ourselves non-verbally. So I think that is something that we need to pick up more, and certainly we had that at Leicester, and certainly I think we're seeing this here as well, Pauline, aren't we?
We are. I mean, Scouse is a language and a culture in itself, isn't it? It's a little microcosm in all of that. And I think sometimes, you know, even if you've had part of your education in the UK before you came to Liverpool, I think Liverpool is a very unique experience in many ways.
We're certainly looking at it from simulation perspective as well, because there was also sort of feedback about language through phone calls, and a lot of the students now, particularly because of COVID, they're having to work online, they're having to work via phone calls, so they're losing that the non-verbal communication as well. So it's very much about language and being able to pick up the nuances of verbal language through different means as well. So we do practice some sort of telephone calls and so on, and how we sort of, we do that in our simulation, don't we, Nikki?
Yeah, I'm asking because I work in the English language centre, so I was just kind of my ears pricked up when I was thinking about language support and things like that, and wondering what we could do in order to kind of to help provide the language support.
It would be good to touch base about that, definitely. Yeah.
Well, feel free to get in touch.
Yeah.
Thanks, Lisa.
Can I ask a question, if we've got time, John? I guess I wanted to ask whether you looked at universal design for learning. That's a kind of principle that kind of very much the key phrase is multiple means. So I was struck by kind of some students not enjoying the kind of party culture. And I wouldn't say get rid of the party culture. I'd be probably kind of thinking, okay, what choices can we give students? But the question one, I suppose, was around, what support gets given to the clinicians and to the non-international students You know, ideally, it's not just about international students conforming to us.
No,
it's about us all working together, isn't it? So I don't know if you have anything to say about that.
I mean, I'll say a couple of, and I'm sure Pauline, yeah, but so two things really. We do interprofessional learning, and we've been discussing about how to use interprofessional learning both ways, so that we learn about their culture and they learn about our culture. So it's not them necessarily fitting into the NHS, but being aware of how to fit in, but also us, and the clinicians flagged that up as well, in terms of, you know, understanding, being able to understand their culture, so we're not sort of, it's just not a one-way street. And the other thing we were discussing was gamification, so that we're starting to look at using that in interprofessional learning, in terms of not making it trivialized, but sort of allowing them to socialize, and not just being very formal with it, but allowing them to do it in a safe space, and actually learn about each other in a fun way. But yeah, we had that discussion, didn't we, Pauline?
We did, and our educators, or clinicians as they are in the presentation, they all do receive training. They attend one of our training courses before they actually receive students for the first time. But of course, depending on when they did that training, of course, we do offer updates which not everybody can attend. But again, what we've tried to do in our training is include some cultural awareness, and the fact that we are getting an increasing number of international students. So the probably newer educators that have been on the latest programme with us will have more awareness of the support available for our students. Older, more experienced educators, less so. So that's interesting. The other thing, and this was mentioned earlier in one of the other talks, but actually being able to sort of allow students, international students, to present, you know, how their healthcare system works, I think is a really important part of internationalisation and globalisation, and other, you know, even UK students understanding different healthcare systems. So I think there's a real rich thing that we can tap into there in some way, that we need to develop, that will allow us then to give our own UK students a wider perspective as well.
That's fantastic. I mean, I absolutely love that. And I think, you know, while there are challenges, you know, kind of there's also absolute massive benefits about internationalization. And I think it sounds like you're doing some phenomenal work there.